How prepared is Hawaii's healthcare system for the predicted increase in the number of coronavirus cases in the islands? Are there enough hospital beds, ventilators, and protective equipment? Where do thousands of unemployed workers find resources to pay rent, utilities, and other bills that are due? And how do we cope with the stress this crisis has created? Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Daryl Huff. COVID-19 has devastated Hawaii's economy, forcing companies to lay off or furlough tens of thousands of workers, more than 200,000 now. People are in need of everything from money to food to information and even therapy from all the stress the situation has created. PBS Hawaii has compiled relevant, useful, and timely information on COVID-19 in one place on our website at pbshawaii.org. You will find details on how to protect yourself and others, state and county stay-at-home orders, as well as resources for families. We will post this graphic again before the end of the program. We have redesigned our in-studio set, as you can see, with social distancing in mind, making sure we are at least 6 feet apart from the next person. And starting tonight, some of our guests will appear via conference program through the internet. This is one of many ways that technology is helping us to get through the crisis. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Joining us in studio is Dr. Julius Pham, the Interim Chief Quality Officer of the Queens Health Systems, which includes 4 hospitals on 3 islands and numerous smaller healthcare centers. John Nouchi is the Deputy Director of Transportation Services with the City and County of Honolulu, which oversees the bus, handy van, beaky, and parking services. Norm Baker is the Interim President and CEO of Aloha United Way, which is the primary contact for COVID-19 response information for the state. And joining us via the internet is Aukahi Austin Seabury. She's a psychologist and executive director of I Ola Lahui, a nonprofit organization that provides mental health services for Native Hawaiians and rural communities. I'd like to point out that Aukahi in the studio is joining us with these monitors up here, so she can at least be part of our ohana here in the studio. Let me start off. Norm Baker from Aloha United Way. What kind of questions, how has it evolved? You're the 211 line recipient, right? So
that's correct.
How has that evolved in terms of what are people asking you for?
It's really been very interesting. In the last first couple of 3 days, about 85-90% of the calls were about the disease, how to protect myself, how to take care of someone in my family that's showing symptoms. 2 weeks in now, that's completely dropped down. It's about 10% now. What we're really getting now are calls around the economic impact. And the majority of the calls are around housing, shelter, and to some extent, food security.
What happens when you get a call from somebody?
We have, I'm proud to say, we have live operators so that when you call, you're going to talk to a person and not have to push a bunch of buttons. The person will then listen to your concern and try to figure out where the best location is to refer you to in order to get the services that you need.
Dr. Pham, just following on what Norm Baker said, that people are asking fewer questions about the disease and more questions about their personal circumstances. Do you feel like people have kind of figured out what this disease is about in terms of the lay people? Or you still get lots of questions about how it works, what they should be worried about, that sort of thing?
Yeah, we have a hotline first. So for folks that want information, they can call into our COVID hotline, and the number there, I hope our folks make sure I get it right, is 808-691-CO19 for COVID-19. And so we do a few things on that hotline. We answer questions that folks have, and then we do pre-screening. So people that feel like they need to come into the ED or into our clinics, they can talk to somebody and get that screening. They also can be set up for COVID testing. So if you meet the right circumstances, you can get testing. The vast majority of our questions are around symptomatology, whether or not they should come in and whether or not they should be tested. It's interesting for me to hear, and it probably represents the larger community concern about housing, food and economics, because from our perspective,
It's all about the disease.
Yeah, people are talking about the disease. So it's definitely an aspect that I hadn't appreciated before.
Yeah, when you hear that we have 200,000 people who have applied for unemployment, it's very obvious that the economics in this situation are really coming to the forefront now, and that's what we're going to need to address over the next 3 or 4 weeks.
Let me ask Alkahi online, what kind of things are you seeing? You don't have to give me a whole long list, but what do you think is the one or two top concerns you're hearing from the people that you deal with?
Oh, I would say absolutely we're seeing an increase in stress and anxiety concerns overall, even for folks that don't originally have that condition. If you can imagine, if you were part of a vulnerable population before, whether you were someone who had unstable housing, had difficulty with finances or accessing food, you had a challenging work situation, whatever it is, or even just in your own home you weren't safe, COVID-19 has really put extra pressure on everybody who's going through those things, and even the folks that have safe and secure homes and safe and secure jobs. Everybody's feeling that squeeze, and so that's bubbling up in a big way in terms of it's showing up as stress and anxiety.
And then let me ask John Nouchi from the Department of Transportation Services. We all notice I have to drive to work every day. I drive to work, I come home. Drive to work, come home. So I see my little stretch of the highway. But it does seem like it's a whole new world out there for how people are getting around.
It really is. There was a time when everybody's regular conversation or routine in Honolulu was about traffic. You talk about weather, you talk about traffic. People don't have a lot of traffic to talk about anymore. So, I think as it was before, as it shall be in the future, as it is now, the thing we hear most about right now is parking and public transportation for the bus and the handy van.
How has public transportation been affected?
Public transportation, in a lot of ways, it's taken a big hit in terms of ridership and revenue. Our ridership on a weekday, we used to do about 200,000 riders on any given weekday. Now that's down to about 66,000. So we've lost about 67% of our ridership, but that doesn't mean that we're not still seeing crowded buses during the peak periods. So, we always like to look at transit as just like a city service and a necessary good. I mean, it's almost just like water, refuse, maintenance. It's something in the city that starts and it's just expected to be there as a necessary, essential city service.
Can I have a question for John? We advocate for social distancing, but recognizing that being on a bus, it's kind of tough to do. I wonder what you guys are doing around that for your bus.
So what we're doing in terms of social distancing, recognizing that our regular buses are only about 8 feet wide, let's say, on the interior, it is hard to provide for social distancing. So if you look at the emergency orders, it talked of social distancing and it spoke about it as if we're practicable. And so we have seen our loads decrease to a certain extent, but we are seeing some trips in the peak hours when essential workers are still going to work and coming home from work in the PM, where the buses have gotten a little bit more crowded. Now, back in the day, we had some trips that had 70 people from the front, the yellow line, all the way at the front, all the way to the back, standing and full seated loads. We're not seeing that anymore, but I'm glad that people have that enhanced sense of sensitivity about distancing. We have looked at the types of buses that we've deployed to the different routes. And on a daily basis, we're actually doing a lot of data analysis to find out which trips are more crowded and which ones are not. And we've been redeploying our larger 60-foot articulated buses, the ones with the accordion in the middle, to some trips where normally, we wouldn't have used them before because we didn't need the capacity. But it's basically another 20 feet extra of bus that we can have where people can spread out and find some comfort in knowing they're not pressed up against sitting right next to somebody if they don't have to be.
In some of the other municipalities, I've seen them ward off or cross off every other seat. Is that something that you're doing? Is that even feasible with our bus system?
Not at this point, no, but what we have done is we've made something called the red zone. So on some of our older buses, and there's an area behind the driver that we've taped off with red demarcation to tell passengers, do not use these seats, do not stand in this area. And that's to give the operator a cushion of social distancing too. Understanding that people still have to walk by our bus operators. And that is a workforce that we're very concerned about. We're equipping them more with masks, and we're also looking at face shields and other things like that. Also looking at ways that maybe we can barrier off their driver compartment to make them less vulnerable. And to that end, it's really, we'd like our passengers just to realize that, if you wear a mask on board the bus, if you take personal precautions for yourself, you're really doing everybody in the bus, all your fellow passengers, but more importantly, you're doing our driver a big favor by not causing undue risk for them. And that is a workforce we're really worried about.
Doctor, I find your questioning interesting. It seems like you're very concerned about public transit as a possible vector.
Yeah, absolutely. So, we provide services at the hospital, but we recognize that we are downstream. So this is a public health disease, and this is going to be won or lost in the public sector, not in the hospital. Because by the time you get to the hospital, it's already too late. You've already contracted it from somebody. So absolutely. And so these ideas, these areas of public gatherings, these areas where it used to be, we saw the vast majority of our cases is travel related or travel industry related. So people that have interactions with the tourist industry. Now, we've done a great job of stopping essentially all travel and tourism to the state, which has definitely hurt the economy, but it really has helped us in the healthcare field. But there are still pockets, and the bus is a great example of that, where I do have concern. And if I can ask a couple of follow-up questions, I'm sorry.
Let's circle back around, because I want to make sure I involve all the panel. And plus, let's see what we get from our viewers, because I'm starting to get viewer questions.
Yeah.
Absolutely. If you don't get your answers, go for it. But let me just move along on another. Aukahi, that this line of questioning about social distancing in our community, we're the two positive tests on Molokai were quite striking, because here this is a very Native Hawaiian community. The folks that got sick were very much in the community. They worked at a grocery store and so on. What kind of additional stress comes into a people who is so used to touching, caring for, physically loving each other? How is that playing out? Are you hearing about that from your clients?
Oh, absolutely. I mean, I think that one of the things that we talk a lot about is the idea that social distancing is something that we have to do. It's a necessary public health step. And in many ways, it goes contrary to the ideas about the way that we communicate affiliation and affection in our lahui, in our community. And so this idea about helping people to understand how to continue to connect and have those meaningful exchanges when you're not able to honi, when you're not able to physically contact one another, is a really big deal. And an important, vital part of us all being able to hang in there throughout however long we need to do our part by continuing to do social distancing. I mean, in some senses, we're talking about something that will likely fundamentally have to change in our awareness of preventive measures going forward, but then also that the fundamental spirit of our people will remain the same. And so when you look at Molokai, and you look at that wonderful community there, they really were trying to be proactive about not having that influx and not having COVID make its way over there, because they understood that their health system there is already strained, right? There's insufficiency of specialty care on the neighbor islands is a really long-standing and well-known issue. And so the idea that we are going to now, again, squeeze a community that's already challenged in terms of health system and health resources is probably a big part of why they were so active and engaged in trying to prevent the spread in their community.
Can I ask, have there been new behaviors that have developed in how people can nicely say, you're too close to me, or where's your mask? Are there nice ways of expressing that without coming off as being, kind of pushy?
Oh, sure. Well, I mean, I think we lean on the stuff we know. We know how to shaka. We just do the deep and far shaka instead of the close-up one. No, I'm joking. But I think that we all find ways to manage that. I think it's been a real cooperative thing where people are still trying to navigate that. Do you really not hug someone when you go to a funeral? Well, right now, there's a different way to do that, and they're not holding them as much anymore. So I think that we're all trying to do our part to make this easier on ourselves, because as a community, it's kind of counter to the way that we function. So it's something we're all just having to do our best with.
Norm Baker from Malloy United Way, are you getting a lot of requests for mental health referrals and stuff?
That is certainly a growing area, yes. It's something that it's obviously going to be something that we're going to have to deal with in a real near term. A lot of our agencies that do family counseling and that type of work are gradually shifting over to just sort of the basic stress management and anxiety management kinds of counseling.
Really? So literally organizations that would be doing one thing are now learning to do another because of this?
They've always been in that business, and they just shift gears. It's kind of like us when this kicked off. Our 2-on-1 center was 5 people. It's now 12 because we had to take people that were doing other jobs and shove them in there and make sure we got the task done. And so all the nonprofits are responding that way.
Is that in line with the increase in the number of calls you're getting?
It is. Actually, our average call rate prior to COVID was about 300 a week. The week of the 25th of March, it was 3,800. So
Wow.
It's more than tenfold.
Doctor, I've got a couple of medical questions that have come in. Actually, a number of them. I'll take them one at a time. So this caller says that she watched a program on National Geographic about doctors dealing with smallpox. When they were done, they showered in Lysol and were germ-free. Why can't we spray ourselves with Lysol?
I won't comment on the Lysol. I don't think...
No product endorsements?
Yeah, no product endorsements. But by and large, for our staff members, we recommend that they take whatever precautions they feel is comfortable. We tell them that if they choose to, we recommend perhaps leaving a change of clothes in the car, perhaps leaving a pair of shoes in the car that they can change out of either at work or at home right when they get home and change out the pair of shoes. That's what I personally do. Before I am allowed to do anything else with the kids, I have to go wash my hands and change out of my clothes. I'm not sure that we need to shower ourselves in Lysol. For the vast majority of our interactions, what we know about this virus is it's spread by droplet precautions. So that means that these are large droplets, probably about the size of what you could have in a spray bottle. So imagine, you're spraying a spray bottle, how far that goes and how quickly it drops. Now, there are unusual and cases where it has spread during smaller droplets, but by and large, the vast majority of it is these larger droplets.
And then another question was, I thought was interesting, is they're asking how, of the people who get sick, how many are going to get really sick? I mean, you have a sense of that at this point?
Yeah, so the numbers that you had mentioned before the show is if you had 100 people sick, 20 people would require hospitalization. Of those 20 people, anywhere between 5 and 10 would require intensive care unit, which means really sick, and about anywhere between 1 and 3 from those would pass away. We actually haven't seen that number as high here in Hawaii. Our numbers are much lower than that, probably on the 5% requiring intensive care unit, and our mortality rate is closer to the 1% than the 3%.
Why do you think that is?
It's hard to say. You would think that here in Hawaii we have an older population, that we would be more susceptible. We haven't seen that. I'd love to take credit for our healthcare system in picking that up.
Well, take some credit for all the hard work you're doing and all of your colleagues.
I appreciate that.
John Nucci, the doctor was already getting at this, but have you guys thought about just not letting people ride the bus unless they've got a mask, now that the mayor has said you got to wear a mask? I mean, I think that makes sense to you, doctor? Or?
Yeah, I don't want to put anything on John. I just have a million questions. Do you mind if I ask just some of them? Or?
Oh, yeah, go ahead. We got an hour.
Yeah. So interesting to me is, what do you do for people when they don't have a mask when they get on? And then what do you do for people when they start coughing on the bus?
So earlier on, I think earlier in January into February, we started doing messaging campaigns on board the bus that instructed people to be respectful of their neighbors, cover your cough, encouraging people to wash their hands. And you may have seen this cycling through on our buses where we had one of the messages on the destination signs of the buses, wash your hands, stay at home when sick, those kinds of messagings. We've also went with wear a mask in terms of just doing good reinforcing public relations messages. To that end, too, we are a federally funded venture, and it is very hard for us as a public transit system, a federally funded public transit system, to deny people trips on board the bus. But that said, if there is an issue, our operators are free to call in. If they think that there's a health issue or anything like that, they can call in for assistance.
Do the drivers? This is another thing. I mean, it's never been a driver's job to tell people where they can sit on the bus. But do the drivers ever say, "Why don't you guys separate"? Is that part of their job? Or they?
I think the driver has a lot to do in terms of just driving that vehicle, which weighs a lot and is a very large vehicle down the road. And to me, I have never wanted to make that part of the operator's responsibility to have to police the riders in such a way. We are looking at, though, as we watch our ridership kind of level off, and we've kind of patched up the schedule such that we can maintain proper social distancing. And to that end, we're learning every day where maybe there are gaps that we need to fill in the system. But we hope that the ridership kind of stabilizes out, and that as this goes on and the suggestion to wear a mask all the time, that people start taking more personal responsibility to wear masks and things like that. And I think we will see that shift. I mean, I know just being, when I go out and make essential trips and things like that, you see people reacting in a very visceral way to things that maybe never affected them before. I was in a store the other day, somebody open-mouthed coughed, and everybody literally ducked and ran. And everybody made no, I mean, that's the kind of thing that wouldn't have triggered people before. But everybody's so, their nerves are frayed.
Let me ask this question. Alkahi, what are people most stressed about? Is it dying? Is it their family members? Or is it the system that we have in place to prevent this thing from spreading?
What aren't they stressed about, really? I mean, I think that there's a list of a number of stressors that are contributing here. I mean, I think first and foremost is the safety of themselves, their family members, their loved ones. I do think there's some that has to do with overexposure to the media in some ways, that because there's this steady stream of information that they can access 24 hours a day, that much of participating in that information increases the stress level. And so being more selective about where you get your source of information from and that kind of a thing is an important part of what's contributing to stress. I do also think then living with the realities that we all face as part of social distancing and with businesses closed and access to resources being more challenged, access to food being more challenged, I think all of those things contribute to stress. And then, of course, when you're talking about folks that do have a home and have multiple family members now trying to coexist in one place, you're talking about students who might be needing to participate online in school while their parents are working remotely right near them. And so there's this dual task that's going on and lots of energy in the household in ways that families haven't had to interact maybe ever. And so all of those are sources of stress, really.
What I'm thinking about is my parents, as you might guess, are pretty elderly since I'm getting there myself, and my mother-in-law and so on. And Norm, I'm going to out you as the oldest member of our panel today.
No doubt.
How, as an older person, so much of the messaging at the beginning was, you're at risk. How much has your lifestyle changed because of this? You're running an organization where it must be very difficult for you to just hide out.
No, it's actually impossible. I think when it first came out, my wife and I were both very, very nervous about the fact that we are in that group. We're in that sort of group. But now I think it's gotten to the point where we've accepted that, and it's just we're going to get on with our lives. We're trying to keep as healthy as we possibly can and not add to the stress. I was just thinking about what you were talking about with the large families. I think another problem would be someone that's alone. I've said to my wife 2 or 3 times when I got home, Well, I'm glad I have someone just to come and tell you about what happened today and how bad this was and how this went. Because if you didn't have someone to share that with, it would really, I think, it's almost worse than having too many people around, I think.
Okahi, you said something.
Oh, absolutely.
You said something earlier that really was striking about how do you hug someone at a funeral, and that to me it really affected me pretty deeply. There are people will have to cope and learn how to grieve in this time when you can't have physical contact. They're gonna have to relearn ways to process loss loss of life and loss of other things during this time. And it's a very heavy toll, I think, to carry. And so I'm glad that, we have people like Okahi who are making themselves available to those who really need it.
Okay, could you please talk a little bit about what you folks are doing about your older and particularly shut-ins and people who right now don't have the daycare program that they might go to?
Yeah. Yes, we have a Kuponen caregiver program, and so we've moved all of that online so that we can do telephone and online kinds of classes and have access for them so that isolation doesn't hit them quite so hard. We know that we have to increase contact right now because folks that are living alone, especially kupuna, are particularly vulnerable because they're sitting there and maybe the only messages coming in are the messages about what to worry about and that you have to stay safe. And there may not be as many voices telling them that everything's going to be okay. I've heard some really wonderful stories about churches that are offering online services so that people can worship together. And similarly, we have fitness classes. So I teach hula on Tuesday nights on Zoom. And so we have all of our participants all on screen together so that they can keep moving and dancing because they have to move their bodies. When you can't get out and walk, you become a fall risk. And that's not something that we want to have happening for our kupuna right now. We want them to stay well. And so getting them to move in their homes is a really big part of it.
How do you help them with the technology?
Oh, yeah. Well, you just take your time and one click at a time, you talk them through it. I mean, and the thing is many kupuna are actually quite savvy with technology, to be honest.
None of mine are.
Because they have grandchildren and family members with smartphones, and so they each access it in a particular way. And what I understand is when the motivation is strong enough, they will figure it out because they've lived through more technology changes than I have, certainly, right? When you think about what they've lived through in their time. So just the next thing.
Opportunity to learn something new and valuable, right? Doctor, a number of questions now coming in again on the medical side. Actually, I want to ask a question myself. Have you gone through the process of helping find contacts for people who are positive? Are you involved in that process at the hospital? Like if someone comes in positive, Dr. Sarah Park made a comment I heard off of one Senate hearing where she said she's finding that when she looks back, it's not that easy to catch this thing. She said, I've had close family members who lived in the same house, and you'd think that they would be subject, but they're not. Is that something you're seeing?
Yeah, so absolutely. As I mentioned, these are large droplets. This is a disease of human-to-human close contact, by and large, as opposed to just in passing. And I'll give you the example of, you mentioned the 2 cases in Molokai. The first case was somebody who worked in an area of very close community, interacted with lots of people in the community. But the majority of those folks that were tested were negative. It was only the close interaction, personal interaction with that individual that was positive.
Oh, so those test results have begun to come back?
Yes.
From the community?
Yeah, from the
because there was great fear that was going to be a major outbreak there, and if indeed it's not coming in that way, man, that's a relief.
Yeah, as far as we know right now, it's only 2 cases in Molokai. So your original question about what we call contact tracing and going back and seeing, by and large, in the community that belongs to Sarah Park's team and at the Department of Health, but we do tracing among our own staff. So every time we have a patient that's positive, we do go and trace back to everyone that interacted with that patient and then see what kind of interactions they had, what kind of protective equipment they were wearing at the time.
I've got 2 questions here about testing, and it tracks the debate that we've been hearing about testing, widespread testing versus the kind of more precise testing that's being done here, and asymptomatic people testing positive. So one question is, what's the likelihood of testing asymptomatic people as suggested by Lieutenant Governor Josh Green? I would put that to you more. How valuable is it, do you think, to you as someone tracking these things, to test asymptomatic people? To what degree are you able to do that, and do you do that?
Yeah, we want to be very clear. We do not test asymptomatic individuals.
At Queens?
At Queens, that's absolutely right. You know, there's 1.4 million.
But that's by your choice, right?
That's our choice, the Hawaii Department of
So you
Health's
agree
recommendation.
with that recommendation?
And the CDC's recommendation. So both nationally at the state level and within our organization. And I think your viewers would understand, I mean, we have 1.4 million people here in the state of Hawaii. And we definitely cannot test 1.4 million people. And so we have to make a decision on how are we going to redistribute those tests to the people that need it the most in the most timely way. And so in terms of making that prioritization, the people that are symptomatic have to have priority over the asymptomatic folks. And so that's our strategy around testing of these patients.
Do you feel, you know, just yesterday, I believe, a new projected curve came out from the data people at University of Washington, and every time they have done that, it's gotten more optimistic for the state of Hawaii. In fact, they're basically saying the peak is this Sunday, and that by May, there won't be hardly any new positive cases found. Do you think that, from what you're seeing on the ground, are you as confident as that?
Yeah, so first on those models, I think those models are problematic, but based upon that, the numbers that we're seeing here are much better than what the models are predicting. I'll give you an example. The models say that we should be at over 100 hospitalizations, but our hospitalizations is 20-some patients.
Is that at a given time, or
that's today. Yeah. That's
okay. Today.
Yeah. So the model says
Snapshot.
today we should have 100. I want to say about 120, 130. I don't have the exact numbers, but we're well below that.
Why aren't we hospitalizing as many?
So great question. One is our cases are much lower than what the models say. And
The gross number of cases.
Yeah, the total number of cases. And then the second thing is that the numbers that we do see, less are being hospitalized. And that's the same debate in the question that you had before is, you know, our death rate is not as high and our hospitalization rate is not as high.
I've got several questions for John. Well, one's an opinion. Buses should make it mandatory to wear masks. You probably could do that under the way these orders are written. You pretty much could tell anybody to do anything at this point, right? I know you're not the lawyer, so. What would you recommend to seniors who are dependent on cabs and the smaller transportation companies contracted through medical providers? Some of those vehicles are, I should have read this question before I read this question, filthy. Is that in your bailiwick at all, the private transportation companies? And
Not those particular ones, no.
maybe Dorn Baker, I mean, you folks help arrange for transportation for elderly folks.
Mm-hmm.
Are you getting complaints about stuff like this? Is that system still operating effectively?
It seems to be, and we've gotten no complaints about it, other than it's late, it always is. And that's the complaint we get all the time. But no, we've had no complaints at all.
John, how often are they wiping down the poles, handles on the bus? What about sanitation?
So the sanitizing of the buses has occurred, and it does occur on a daily basis. Since late January, we've been actually wiping daily the high-touch areas of the buses, and that's the door handles, any grab bars on bus seats, those types of areas. And recently, we've started using electrostatic cleansing nightly of the bus fleet to, provide enhanced cleaning of the buses. But that being said, that bus would be clean at that moment. But once it goes out and it goes through the rigors of its duty every day, the bus does come back dirty. So we do what we can, but there is no way that with the public, the vehicle being out in public, that we can guarantee that the vehicle is 100% clean.
Daryl, can I ask a follow-up on that?
I was just asking you, but go ahead.
Do you have alcohol dispensers on your buses?
No, we don't.
I think you suggested you get some. Doctor, though, we heard a lot of as I understand it now, when this was first happening, which we feel like it was years ago, but it's like 2.5 months, we heard a lot of studies that said, oh, this is how you can get infected. Like, for example, we had a doctor or not a doctor, but a researcher in California sending messages to Hawaii that people surfing out should not be surfing because the droplets could travel on the trade winds. We had the reports that it could last 14 days on a surface and still infect you. What is the most common rule about that? I mean, should we be really worried about surfaces on the bus if we're taking good care of our own hygiene?
Yeah. So surfing is safe. So stay out there.
Unless you drown.
So the most common mode of transmission is through your hands and contact with your face. So the portal of entry for this virus is through your eyes, your nose, and your mouth. Now, how it gets there is most likely is your own hands. I don't think that too many other people are touching your mouth, your nose, or your eyes these days. May have been the case before. But most likely what will happen is that somebody who is infected will cough onto a surface. They will touch that high-touch surface. Then you touch that high-touch surface, and then you go and touch your mouth. And that's why these masks are so valuable. To some extent, it's not because it filters anything out. Some of these masks are made of cotton, but they remind us and they prevent us from touching our mouth and our face. And if we don't touch our mouth and our face, then we can't get this disease. Secondly, I mentioned the alcohol hand sanitizer. So one of the predication is when you're touching your mouth, your nose, and your eyes is that they're infected. But if you hand sanitize your hands, then when it makes contact, then it won't. So I think of it as several barriers. So the first barrier is don't touch those surfaces in the first place. If you do touch those surfaces, clean your hands. So hand sanitize your hands. And even if you forget to hand sanitize your hands, but you never touch your face, then you're probably going to be okay.
Norm, are you doing that?
I am indeed. You know, what concerns me about all this is that there's this hidden, about to hit us financial disaster in the community. And we're all worried about the disease and we're all worried about limiting the transmission and all of that. But I think we need to turn our focus onto helping the 200,000 folks that just filed for unemployment. How are they going to pay rent next month? How are they going to buy food for their families? Those are things that we need to start addressing them now before it's a tsunami coming at us, and it's not that far away.
Kahi, on that point, are you hearing there must be a lot of fears among the people that you deal with the most about their economic situation now and that of their families?
Oh, absolutely. Many of my patients and the folks that participate in our programs have lost their jobs and are part of that group. They're furloughed or they're lost their jobs completely. And so absolutely, that's a big reality that we're all going to be facing. I think it's going to touch almost everyone in some way. And certainly the folks that were teetering on the edge of okay have slipped even more quickly into the not okay range. And so programs like those that the Aloha United Way can connect everybody with are really important, and also figuring out how each individual agency, business, as they're all trying to recover and manage all of this, what they can do to soften that blow as well. So, for example, for us, that's about sliding fee scale or, free services for folks that need it when they've lost their job and, don't have their insurance and they haven't yet accessed Quest, for example. That we all have to think about ways to make sure to lift our folks up as we move along, because it's going to be pretty substantial what comes next.
Let me ask this question, because I have a tendency to be the kind of person that's very irritating, is that when someone tells me, oh, I'm stressed about this, I'll tell them all the reasons they shouldn't be stressed. And I'm sure that's the wrong approach. What works? I mean, I want to give you facts. I want to tell you, don't worry, in 2 weeks you're going to get a big check from the government. Don't worry, eventually the unemployment system will work. But is that the way to calm somebody down in the situation, or are there better ways?
Well, a portion of what people worry about has to do with accurate and effective and helpful information. But much of what's stressful about this is there are just a lot of unknowns. So is that check from the government going to do much, and for how long? If you've lost your job, that's not going to take care of you for a long time. So much more of what helps people cope with anxiety or stress in these situations has to do with activating the things that they already know how to do to stay healthy and calm and centered. So what do those look like? Probably physical activity, probably engaging with their spiritual practices, whatever those are, probably strong social support. So that list about problem-solving worries is only one small piece of what people do to stay well. Limiting exposure to the media, honestly, and picking positive programs, that are talking about what you can do instead of just playing the scary, thundering music and talking about how bad it is probably a really important part of it as well. So the idea is about how do we cope. It's almost like everybody's got to be expert in the coping strategies they've only sort of used before now. They've really got to do them very intentionally. And that's like get up every day, get dressed, and have a schedule, whether or not you have a job to go to. Because doing so can help you feel like you have a little bit more control in life than it might feel like if you're just a being who's waiting for the next announcement to tell you what your life is going to look like.
So many of those behaviors that comfort us are not available right now, right? I mean, you can't really go to church. You can't go to McDonald's and sit around and have a cup of coffee with your friends. You can't just go ride on the bus and go around the island, right? So
Please don't.
Yeah, exactly.
Essential trips only.
Exactly. So is that being enforced on the bus? I mean, you can't enforce it, but I mean...
Like I said, all we can do right now is message to people, essential trips only. And I think we were seeing a lot of that earlier on, where people who didn't have anything to do, I happened to take the bus on an errand for work. And both ways, I saw a family that, they were marveling that they hadn't been on the bus in years, but yet they were taking the kids out because the kids just needed to get out of the house. And that's exactly the problem right there. This is not, it's a stay-at-home order, and this is not for field tripping. This is not, God, I can't believe I'm going to make myself sound like an old person and use the word gallivanting, but this is not a time to gallivant.
I think that's multi-generational.
Sure. You only use it in a negative context when you're trying to make a point, though.
Okay. Gallivanting, yeah.
Well,
Go ahead.
speaking of all that, I mean, I think, there's some really cool things. I just heard Iolani Palace is doing virtual tours online. So there are a lot of ways that you have to kind of, your self-care is not going to look the same as it did before. If you were someone who routinely went jogging at a beach park that had lovely pathways, well, you can't really do that now. And so what your self-care has to look like will look different, but you still have to figure out how to do it. And so, taking your kids on a virtual field trip, it's maybe not as good as getting on the bus and taking a ride, which people should do at another time when it's safe and appropriate. But for right now, coming up with creative ways to do that at home is the part of surviving this. And so, helping people understand how to access their spiritual practices and faith at home is really important. Cultural practice, same thing, So I think all of this necessity is breeding innovation. I think it's forcing it for all of us. We have to figure out how to do it differently because this is not something that's going to be done in a short amount of time. And so we all have to dig deep and be creative.
To me,
so,
what's really interesting
I think there's some inspiring things to lean on. But yeah, they don't look like the regular ways we've done things,
To see how people have just become so adept and to see kind of the depth of resilience that people have had is one of the really nice things if there is any positivity that comes out of all this, it's just how resilient people are. And, I really get inspired by watching some of my my peers on social media, which of course is normally a big echo chamber. But you do get to see the flashes of resilience where, especially like our teachers, I think my hat's off to teachers who have basically had about 2 weeks to adapt to a whole 100% new normal. And so there are teachers who have just adapted in such refreshing ways that I feel like the students are going to come out partially ahead after all of this.
I'm going to try to move us around through some more questions. We're getting quite a number here. If I'm sure that my desk looks very messy to that tall camera they keep putting up. How do you recommend the elderly get around? I guess this is for you, John, to shop and do other errands if they're not able to access the bus. I think there's a misunderstanding in that question, right? If you need to go run errands.
Yes, absolutely. The bus and the handy van are still available for essential trips only, and that can include going out to the doctor, going to food shop, going to get your medicine. And that's why it was very important for us to retain transit service. I know a lot of places were just talking about it, like, why don't you just shut down, But, to the
Vital.
extent that we are an essential city service, there are people who might not be able to get around but for the bus and for the handy van. And to be able to offer that service to our residents, I think, is key. Because, it would be one more blow to the economy if people have no mobility. Mobility,
well,
like
it would be a
like
blow to their ability to feed themselves, too.
That's true, yeah.
Okay, doctor, I got a number of questions for you coming in. Do you think that cases of COVID will increase when the stay-at-home mandate is lifted? This is something that I think is very confusing to people. They see that curve, and they see projections that all of a sudden you're not going to see cases. But I'm also getting questions from people saying, isn't this just like the flu? Isn't the flu, worse than this? But let me ask you, is it realistic to think this is going to go away?
Not away forever. Certainly, we can spread the impact of it out. But to your original question, yes, it will go up once we lift some of the restrictions, and we've seen that in other countries, specifically in China, and now Japan and South Korea. So it's going to be a matter of how much and when. And so what you want is, the truth is, if you come under the assumption that a certain proportion of our population will get this, you accept that and then just say, okay, but why don't you feed it to me slowly and feed it to our health system slowly so that we can handle that volume of patients. And if we do that, then we'll be okay.
Another question, and actually I don't know if this is too technical, but it's a good question. Can you test positive after testing negative? We had this discussion today in our newsroom about what's the process of proving that you don't have it? Because if you get tested when you're not symptomatic or early and you test negative, that's not a very accurate test, right? So you need to, how do you then prove that you're really negative if they say want to put you back at work, for example?
Yeah, so I think the answer to that, if we just think about it for a second, is evident. If I test you negative today and you get infected tomorrow and I test you tomorrow, then of course you'll be positive, right? So just because you're negative today doesn't mean you'll be negative for the rest of your life or for next week or the following week. And exactly as you mentioned, that's the issue when you test asymptomatic people is they get the sense that, well, I'm okay, I'm negative now, and maybe I'm going to go out and get on John's bus and start gallivanting.
Another question that we're getting is, I think, about the recovery. With a lot of conditions, there's a stigma that starts attaching to it. Are we seeing stigma attached, and can we be confident when someone is through their treatment? I know you've had cases where you couldn't even find a place for a recovering patient to go stay because of the stigma. That's a very alarming set of facts, but what about when people are cured? Are they cured? Are a lot of people recovering, and then you think that they really do have a clean bill of health and maybe immunity to this thing?
Yeah, so the first question is, when they're cured, are they cured? The answer to that is most likely yes. This follows many of the other respiratory viruses that we've seen. And do they have immunity to that? Most likely, yes. We don't have definitive data for that. But if it acts and behaves like many of the other viruses similar to this, then you will. I can't remember your other question. Is the stigma there? I can imagine if I walked into this studio and I said, I just had coronavirus yesterday or last week, but I'm okay, guys. I can imagine people will want to stay away from me still.
I'm sure hopefully that'll be our last show on this subject. Have something like that.
I have a surprise announcement at the end here. But I think that with time, if I told you, well, I had it last month, I'm okay. I suspect most people would say, okay, well, Julius looks pretty good. He had it last month. He's actually probably immune. I don't have anything to be
Are you
worried
personally afraid of getting it?
Me personally, no. I am very confident in the personal protective equipment that we have, both for myself and for our teams. We have a good understanding of what this disease is and how it's transmitted. And if we follow some of the rules, some of the suggestions that we have established, you're going to be fine. So it's not a mysterious thing where somebody got it out of thin air. By and large, as mentioned, this is close contact for a prolonged period of time.
John Nochi, how's Handyvan able to do this? What's changed about the Handyvan operations around this?
Well, what's changed with the Handyvan, and again, I would actually note that our Handyvan, we used to do about 4,300 trips a day, and we were really a high capacity. We might be one of the busiest paratransit type systems in the nation in terms of the ridership that we do. The ridership has dropped.
Paratransit is transit for people with limited mobility.
Yeah,
right?
with disabilities or and that amount of trips has declined to about 1,400 a day.
From what to what?
From about 4,300 to about 1,400.
Okay.
And that had to do a lot with a lot of the sustaining, I think the real good day programs for our kupuna and for others that we transported them to every day. A lot of those programs under the COVID-19 pandemic shut down. And so that took away a lot of the daily demand. And so for one, the Handyvan hasn't been stressed in terms of ridership, but, we have instituted some policies about if we know that someone has been identified as COVID-19 or is under investigation, we cannot take them on board the Handyvan. And the reason for that is we need to take those precautions for some of our riderships, for our kupuna and other more vulnerable patients on board the Handyvan. So
What are they supposed to do?
they have access to other medical transport right now, and so we are kind of working through some of those issues right now. But for the safety of the Handyvan, to as much as we can, if someone identifies as COVID-19, as having the virus, or is under investigation, then we do not offer them a ride.
Norm Baker, that makes me think of something else. When we were talking earlier about the economic tsunami that we're heading into, how prepared do you think we are for that? Do you think the federal money's going to get in here in time? Or you've been around a while, you've seen these programs. How much confidence do you have that all of this federal money is going to keep us afloat?
I don't think it'll keep us afloat. I think we're going to be able to stave off the worst of it for the folks that are most vulnerable in our community. I think there's a large portion of our population that are just going to have to suffer. It's just going to be very, very. Let me give you an example. One of the programs that we are familiar with had a rent assistance program. It opened on Tuesday and it closed on Tuesday afternoon because they received 2,000 phone calls and took 1,200 applications for the program, used up all the money in about 5 hours. So that kind of thing is going to go on, and it's going to go on for quite a while until we get everybody back to work and we get the economy back and stabilized. What we need to do is focus on the folks that are really the most vulnerable, the folks that are homeless now, living in poverty now, or close to that, so that we make sure that we keep them afloat until the federal aid can arrive. Will it arrive on time? There's pieces of it that are arriving now. And so, yes, we're moving in the right direction, and they're doing better at getting the federal aid to us now than they did during the Great Recession. So that's a positive. But it's going to be a difficult time.
Kahi, I'd like to ask you, among the people you deal with, how much of a sense of hope is there out there? Do they believe that this is going to be over? Do they see the light at the end of the tunnel?
I think that we are real careful as health providers and stuff to talk about that there will be a day when we find a new normal. But I guess in the temperature in the community, I think people, I think there is still that branch of hope that this will get easier, that some kind of help will happen, that our leaders will rise and help us find a way through it. I think people are very hopeful and looking in that direction. I think there's also a lot of hope and trust that our community will take care of each other as members. And so the things that nonprofit organizations are doing, the things that our local foundations and funders are trying to get together and leverage and be cooperative and collaborative in how they support those folks that are the most vulnerable. I think hope comes from a lot of different places. I think hope comes when you remember to say thank you in the grocery store, even though you're trying really hard not to spread your cooties or get cooties from anyone else. I mean, I think there's lots of potential for hope around us. And so I think if we can lean and look to those, I think we're all going to do better for as long as this goes. That's the thing.
Okay, Al-Kahi, thank you so much. I like to end on that bit of hope. And that's all we have tonight. Before we go, I want to remind you that for information on COVID-19, check out our website at pbshawaii.org. We've included everything from how to make and wear your own mask to copies of the government stay-at-home orders. Mahalo to all of you for joining us tonight. And we thank our guest, Dr. Julius Pham, Interim Chief Quality Officer, which is kind of a mouthful at the Queens Health Systems, Norm Baker, Interim President, CEO of the Aloha United Way, John Nauchi, Deputy Director of Honolulu's Transportation Services Department, and Al-Kahi Austin Seabury, Executive Director of I'olalahui, who joined us via the internet. Next week on Insights, how public and private schools in Hawaii are handling COVID-19, how the State Unemployment Office is handling the crush of claims, and how a nonprofit is helping protect the homeless. Stay safe, stay healthy, and please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.